Good morning, Mr. Sharma. Please have a seat. I have received your colonoscopy and biopsy reports. Would you like a family member to be present while we discuss them?
Yes, doctor. My wife is here. I'm very anxious. Please tell me honestly.
Of course. The biopsy confirms that you have squamous cell carcinoma of the anal canal. I understand this is difficult news, but I also want you to know that this is one of the cancers where treatment can be highly effective, especially when treated appropriately.
Cancer. Does that mean I will need a major operation and a permanent colostomy?
That's a very common concern. The good news is that most patients with anal canal squamous cell carcinoma do not require surgery as the first treatment. Unlike rectal cancer, the standard treatment is combined chemotherapy and radiation therapy, chemoradiation, which aims to cure the cancer while preserving the anal sphincter and maintaining normal bowel function.
So, surgery is not the first option?
Correct. Surgery is usually reserved only if the cancer does not completely disappear after chemoradiation or if it comes back later. In the majority of patients, surgery can be avoided.
How do you decide my treatment?
First, we need to determine the exact stage of the disease. We will arrange MRI pelvis to assess the local extent, contrast-enhanced CT scan or PET-CT to look for spread, blood tests including complete blood count, liver and kidney function. HIV testing may also be recommended because it can influence management, though it is done confidentially and routinely in many patients with anal cancer.
What does chemotherapy involve?
Chemotherapy is given in low doses to make radiation more effective. The commonly used medicines are mitomycin C with 5-fluorouracil, 5-fu, or mitomycin C with capecitabine tablets. These drugs are not meant to shrink the cancer alone, they act as radiosensitizers, increasing the effectiveness of radiation.
How long will treatment take?
Radiation is usually given Monday to Friday for about 5.5 to 6 weeks. Chemotherapy is given during specific weeks of radiation. Most patients complete the entire treatment in approximately 6 weeks.
Will I lose my hair?
Usually not. The chemotherapy doses used for anal cancer are different from those used in many other cancers. Hair loss is uncommon.
What side effects should I expect?
During treatment, you may experience redness and soreness of the skin around the anus, pain during bowel movements, loose stools or increased bowel frequency, fatigue, mouth ulcers in some patients, temporary lowering of blood counts. We will provide medications, skin care advice, nutritional support, and pain relief to help manage these side effects.
Will the treatment be painful?
Radiation itself is painless. The skin irritation develops gradually over the weeks, but we monitor you every week and treat symptoms promptly.
Will I be admitted to the hospital?
Most patients receive treatment as outpatients. Admission is needed only if there are significant complications or if someone becomes too weak to continue treatment safely at home.
What are my chances of cure?
That depends on the stage, tumor size, and lymph node involvement. However, many patients with localized anal canal squamous cell carcinoma achieve long-term cure with chemoradiation alone.
After treatment ends, how will you know if the cancer has gone?
This is an important point. The tumor often continues to shrink for several months after treatment. We usually examine you regularly and assess the response over time. Imaging such as MRI or PET-CT may be performed when appropriate. We avoid judging the final response too early because the tumor can keep regressing for up to 6 months.
What if some tumor is still left?
If there is persistent disease after an adequate waiting period or if the cancer returns later, we discuss surgery, which may involve an abdominoperineal resection with a permanent colostomy. However, many patients never need this operation.
Can I continue eating normally?
Yes. Eat a balanced, high-protein diet, drink adequate fluids, and avoid foods that worsen diarrhea if it develops. Our dietitian will guide you throughout treatment.
Doctor, I'm frightened.
I understand. A cancer diagnosis is overwhelming. But remember, anal canal squamous cell carcinoma is one of the cancers where modern treatment offers an excellent chance of cure while preserving normal function in many patients. You will have a multidisciplinary team including a radiation oncologist, medical oncologist, surgeon, radiologist, pathologist, nurses, and dietitian supporting you throughout this journey. We will walk with you every step of the way.
Thank you, doctor. I feel much more hopeful now.
You are welcome. Let's begin the staging investigations, discuss your case in our tumor board, and start treatment as soon as possible.